Hey guys, this is Dr. Hub. Today we'll look at the osteogenesis imperfecta and its subtypes. So first is the subtype 1. So under subtype 1 there is a decrease in the synthesis of the pro alpha 1 chain, and there is also the abnormal pro alpha 1. So there is abnormal pro alpha 1 or the alpha 2 chains. So what are the clinical features in terms of the subtype 1? So this includes the presence of the blue sclera. So there is presence of the blue sclera. Then there is also the normal stature. There is a blue sclera, there is normal stature. Then comes the presence of the skeletal fragility. So there is presence of the skeletal fragility, and there are some more points such as the dentigenous imperfecta. There is dentinogenesis imperfecta. Then there is also the hearing defect. So it's the hearing impairment. And there is also the joint laxity. Now let's look at the inheritance and the prognosis. So under the inheritance and the prognosis, the inheritance is nothing but it is AD, that is autosomal dominant. So how is the prognosis? The prognosis is it is compatible with the survival. It is compatible with the survival. Now we'll move on to the subtype 2. So the subtype 2. So what is special about this? The subtype 2, it is the abnormality of the short pro short pro alpha 1 chain and unstable triple helix, and abnormal or insufficient pro alpha 2. So there's abnormal or insufficient pro alpha 2. Now let's look at the clinical features. The clinical features, it includes death in utero. So there's death in utero and or within days of birth or within the days of birth. Next is there is also the presence of the skeletal deformity. There is a skeletal deformity. So this skeletal deformity is associated with the excessive fragility as well as there is multiple fractures. Here also there is a presence of the blue sclera. Now let's look at the inheritance and the prognosis. So in terms of inheritance, it is the most are autosomal recessive and few are autosomal dominant. So mostly it is autosomal recessive and there are some autosomal dominant as well. They are also present. So what about the prognosis here? Prognosis is there is a perinatal lethal. It is perinatal and lethal. Next we move on to the subtype 3. So under subtype 3, it is where the altered structure of propeptides. There is an altered structure and this is of nothing but the propeptides. And the propeptides of the pro-alpha 2, 1, and also the impaired formation, and this is of the triple helix. So how is the clinical features? The clinical features, it includes the GR, there is growth retardation, there is fractures. Let's put a symbol for fractures. There are multiple fractures. And there is also the progressive kyphoscoliosis. Then comes, there is the blue sclera at birth that becomes white. So there is a blue sclera. So there is presence of the blue sclera which becomes white. Then there is also the hearing impairment. There is presence of the hearing impairment and the Dentinogenesis imperfecta. There is Dentinogenesis imperfecta. Now let's look at how is the inheritance pattern and the prognosis. The inheritance pattern is, it is autosomal dominant, and this is in 75%. Next is, it is autosomal recessive, and this will be in about 25%. So how is the prognosis in this case? The prognosis is, it is progressive and the deforming. It is progressive as well as it is deforming. Lastly, we look at the subtype 4. So subtype 4, it refers to a short pro-alpha 2. It is a short pro-alpha 2 chain, and it is unstable triple helix. There is unstable triple helix. Now let's look at the features. So under features, there is the postnatal fractures, and there is a normal sclera. Next is, there is presence of the moderate skeletal fragility. There is presence of the short stature, and there is also sometimes it presents with the Dentinogenesis imperfecta. So there is Dentinogenesis imperfecta. So what is the inheritance and the prognosis? The inheritance is, it is autosomal dominant, and what about the prognosis? The prognosis is, it is compatible with the survival.